I'm at the nurse's station and I see my celebrity patient Donald Trump. Doctor has written an order for him to have a peripheral IV, and then we'll infuse 0.9% saline solution at 125 ml per hour, and he's prescribed 2 liters. So my first step is to get that peripheral IV started for Mr. Trump. His doctor's orders read thusly. His MAR is correct. Patient identifier Donald Trump, date of birth 8/4/1956. On his MAR and on his physician orders, it is exactly the same Donald Trump, date of birth 8/4/1956. Mr. Trump is allergic to allergies, and we know he is a full code status. Outside the room, I'm thinking about several things. Number one, his isolation status. Mr. Trump has no infectious disease. The only PPE I need are the exam gloves, which are in the room. He's been cooperative. I shouldn't need any assistance. Cultural considerations for Mr. Trump, diversity issues. He's a celebrity patient. His privacy is going to be essential. I have all my equipment ready, and I'm ready to go in the room, so let me knock. Mr. Trump asked me in, and I come in and introduce myself. Hello, Mr. Trump. My name is Nina. I'm your student nurse from the Denver School of Nursing Hospital. I'm here to initiate a peripheral IV for you, and I'm going to perform hand hygiene with plenty of alcohol gel for your safety. Mr. Trump, would you please tell me your name and date of birth? My name is Donald Trump. My date of birth is 8/4/1956. Thank you, sir. That matches perfectly to my records. Mr. Trump, can you tell me, do you have any allergies? Oh, I'm just allergic to latex. All right, that is indicated on my records as well. I want to assure you that all of these products and little tools I'm going to use are latex free, and I know you are a full code core status, so I'd like to take good care of you today. You said you've had a peripheral IV before? Yes, you have. Okay, great. You should be familiar with the procedure, and you know it does involve a needle stick, and I'm going to put a tourniquet on your arm, and it's going to be tight, but the discomfort is very, very brief. So if you're all right with it, I'm going to go ahead and start my procedure. Go ahead. Thank you, Mr. Trump. The first thing I'll do is place the tourniquet above the venipuncture site, of course. Now this is going to be tight. And we use the tourniquet to engorge the veins and choose a appropriate site, and I see a vein engorging here. Would it be all right if I start your IV in this area? Yes. Thank you, Mr. Trump. I'll loosen the tourniquet for my patient's comfort while I assemble my saline lock. The components of the saline lock are the ultrasite injection valve, the luer fitting, and my extension set. It also has a male and female luer attachments, which is what we use for a needleless infusion. My injection valve has a male end and a female end. The female end is blue. That's where we'll attach our saline flush, and that is where the infusion tubing attaches. So that means I have to attach my extension set to the male end of the device. So fortunately, there is a female end of the extension set, and they go together. Finger tight will be adequate for this. You don't have to attach it so tight. Maintaining the aseptic condition of the injection valve, I will attach my saline flush My clip is open. I will instill a few drops of saline solution into the extension set, making it into the saline lock. I will close my slide clamp, keeping the device close by for the convenience of my procedure. I'm going to loosen that cap so I can easily remove it and attach it to the catheter hub. So, Mr. Trump, are you ready for me to stick you with the needle? I'm ready. All right. I will clean the skin, as I mentioned before, 15 to 30 seconds with a good brisk scrub on the chosen site. Going back and forth to clean the skin. After 15 to 30 seconds, I can just go ahead and let that dry while I put on my exam gloves. And re-tie my tourniquet so the vein is engorged when I puncture. Now I'm just going to do a double check of my equipment. My saline lock is ready. I have a gauze 2x2 to blot if any blood drops escape. I have my transparent dressing. It's good to open these ahead of time. I have it ready. And I'm ready for my puncture. The vein is nicely engorged. Open my catheter with flare. Find the bevel. I want a bevel up presentation. There it is. I anchor the skin and the vein. I approach my venipuncture site with a 20 to 40 degree angle, and I puncture the skin and into the vein. I'm in the vein because I have my flash of blood. When I know I'm in the vein, I advance the needle and the catheter together a millimeter or so, and then I just advance the catheter while stabilizing the needle. I hold the hub with the index finger of my left hand. I occlude the vein with the middle finger of my left hand, and I go directly into the sharps with the needle. I take off the cap, maintaining asepsis, and I connect the extension set to the catheter hub, securing the hub firmly with the index finger of my left hand. I can't let the hub wiggle around. It will occlude the catheter. So while I'm firmly holding the catheter hub with my left index finger, I tighten the extension set on and I don't let go. I open my clip. I open my tourniquet. I'm still holding on to the catheter hub, and I draw back a little flash of blood, and then I flush 5 ml of normal saline in to assure patency, and securing my site, I close my slide clamp. I take my 2x2 gauze, I clean my site, and I switch hands. I grab my clear dressing and I cover my site. I cover the IV hub and the surrounding skin. When my dressing, also called a tegaderm, when that's in place, then I have both hands free to secure my site. So I'll take the framework off of this dressing, make it look pretty. Take one piece of my tape and secure the extension set. That's pretty long, I don't need all that. At this time I can remove my flush, and I'll tape the extension set down to secure it comfortably for my patient. I don't like to really tape much over the tegaderm because we have that clear dressing so that we are able to visualize our site. So the tourniquet will come off. I'll prepare a label for this IV site. The label will include date and time. It's about 1340. My initials, and the gauge of the catheter. It's a 22. The label goes adjacent to the tegaderm so that we can visualize our site. And the IV is initiated. We have a peripheral IV with a saline lock in place. The location is the left anterior forearm, 22 gauge catheter. I was successful on my first attempt starting this peripheral IV for our celebrity patient, Donald Trump. I'll clean up all of my supplies and make sure Donald's in a comfortable position. I'll lower the bed to its lowest position, give him his call light, advise him to call me if the site becomes painful, if he notices any warmth, redness, or swelling there, and I will go out and document my procedure. The next thing I'll do is go to the pharmacy and gather my 0.9% normal saline and come back and begin Mr. Trump's infusion.